The Antimicrobial Diet. Understanding prion diseases and risks in dentistry and the birth of the antimicrobial diet. Healthcare professionals' concerns about prion diseases. Healthcare professionals, especially those working in dentistry, face significant concerns regarding the risks associated with chronic disease prions. With many patients affected by these conditions, professionals often wonder about their own likelihood of contracting such diseases. Additionally, questions arise about whether they might unknowingly contribute to the spread of these diseases within their practice. What are prion diseases? Recent peer-reviewed literature has brought new insights into prion diseases, such as Creutzfeldt-Jakob disease, CJD, which is known as the human form of mad cow disease. Contrary to earlier beliefs, current research suggests that prion diseases may not actually be caused by prions themselves. This shift in understanding is significant. In the past, flawed research suggested that prions behaved like viruses and were highly contagious, as well as extremely resistant to sterilization. For instance, during the height of mad cow disease in England, any patient diagnosed with CJD was treated as a source of highly dangerous contagion. Surgical instruments used during procedures on these patients were considered impossible to sterilize and were discarded after use to prevent further spread. Current research provides substantial evidence that diabetes, heart disease, and neurological disorders, including Alzheimer's disease, are also considered prion-reactive diseases. Updated understanding of prion disease transmission. Today, our understanding has evolved. It is now known that prions are not the contagion themselves, but rather the body's defense against highly contagious, heat-resistant viruses. This is a crucial distinction, as it changes the way healthcare professionals should approach infection control and disease prevention. Knowledge gap and prevention measures. Unfortunately, most healthcare providers currently possess limited knowledge about the nature of prion diseases and the strategies required to prevent their spread among patients. While this presents a challenge, there is a positive side. These diseases are beginning to be understood more clearly. With early detection, measures can be implemented to prevent prion diseases and even reverse them before they become deeply entrenched and irreversible. Personal reflections and the need for improved protection. Out of concern for the profession, one of my books was dedicated to implant dentistry surgeons who, in my opinion, passed away prematurely due to the effects of modern prion-reactive chronic diseases. It is plausible that these colleagues may have developed terminal illnesses following inadvertent exposure to oral bacteria from their patients. Dentists have not fully realized how contagious these diseases can be, nor how easily bacteria and viruses are transmitted to others, both through physical contact and aerosols in the clinical environment. As a result, there is a pressing need to develop new methods to protect dental professionals from these health hazards and to ensure greater safety for both providers and patients. Avoiding the destructive nature of these viruses. Dr. Nordquist's preventive approach. 12 years ago, Dr. Nordquist initiated a preventive strategy to address his health concerns by incorporating natural antibacterial and antiviral foods into his daily diet. This approach began after he was diagnosed with atherosclerosis of the carotid arteries, a condition that prompted him to seek alternative non-pharmaceutical solutions. Discovering a natural solution, motivated by his diagnosis, Dr. Nordquist researched potential remedies and found promise in ancient Ayurvedic medicine. This traditional remedy consisted of turmeric and pepper mixed into hot milk. He adopted this practice daily, hoping it would help improve his vascular health. Results and insights. 6 months ago, an ultrasound examination revealed that the atherosclerotic plaque in his carotid arteries had been completely eliminated. This outcome reinforced his belief in the power of natural foods. Through his ongoing research, Dr. Nordquist also discovered that many natural foods are rich in polyphenols, compounds known for their anti-inflammatory and antimicrobial properties. Based on these findings, he named his approach the Antimicrobial Diet.